This is not like any other tumor. This is much more challenging. This is not a lung cancer with an EGFR mutation or an ALK translocation. You find the drug, it's a targeted agent, you throw it in, you get a dramatic response, you're done, you go home and declare victory. That's not the situation we face clinically. First of all, we have the challenge of the blood-brain barrier. Almost nothing gets into the brain. And almost everything that gets in at levels substantially lower than in plasma and in blood. This agent is an exception. This is one of the few exceptions of drugs that actually concentrate in the brain. So that's very, very appealing. We have the story of mutations. We don't have an ALK mutation. We don't have an EGFR mutation. We don't have single mutation scenarios. This is a highly mutagenic tumor with numerous mutations. And so attempting to target this with single agents, and rest assured, several of us in this room have been PIs on numerous clinical trials of targeted agents in this disease. And the bottom line, they have all utterly failed. So we know that this drug started off at levels that are already supra-therapeutic, which is really unknown in new drug development. You always start off at sub-therapeutic dose levels. And then we went six-fold higher on these supra-therapeutic dose levels, and yet are seeing minimal to modest to almost no toxicities. So this is an opportunity we don't frequently have in the world of drug development. We are always abutting against toxicity as a major dose-limiting step, and this is something that we are not seeing with this particular drug. This becomes particularly appealing in the context of combinatorial approaches. A number of our existing therapies, radiation, temozolomide, and other therapies, are already at significant levels of toxicity for our patients. And in that context, bringing in a drug that is effectively very, very safe is a very unique opportunity. So this doesn't end with glioblastoma, but if we look at many of the other intracranial neoplasms, at recurrence, none of these tumors have a therapy. None. Now, as primary therapy, several of them can be treated effectively with conventional approaches, surgical resection, radiation, etc. But they all represent potential targets based on biological identification of the appropriate match for targeting, whether this series of compounds could play a role in the intracranial space, especially because of the blood-brain barrier penetrating capability of this group of agents.